I think one of the more unique features of our clinic is our role in clinical trials. Ever since the advent of sumatriptan, we've been very actively involved in looking at new therapies, new treatments for migraine. Some of these, of course, are pharmacologic, but we've also looked at a lot of non-pharmacologic intervention and how they may impact. We've also looked at education, nurse-based education, and how that may and does improve outcomes of migraine therapy. Many of the patients in our practice actually see themselves in this process, this evolution of migraine therapy, if you will. They are actively involved in clinical trials at various points, many times because they may have gone through years of trials and tribulations, and they don't want to see that passed on to their children or to the next generation. So as part of our practice, we are very involved in getting people enrolled in clinical trials. It offers often some new and innovative therapies if they're appropriate for that specific individual. And as I said, I think done for the right reasons, it truly starts to advance the whole topic of migraine and headache care. We've done studies on almost all of the triptan medications. We've also done some of the pivotal studies, the early studies, if you will, that highlighted the role and importance of early intervention, so how to get the most out of your treatment. We've done studies looking at how sinus disease is often really migraine rather than some pathology in the sinuses, and that has sort of become much more accepted. We're looking at things like monoclonal antibodies or shots that people might be able to use to treat migraine. We're looking at a lot of different devices and therapies that are designed to help prevent migraine, cluster headache, and other types of headaches. But I do think it's a unique aspect, and I think very often people with migraine recognize or feel some sort of responsibility, if you will, to advancing the whole field of migraine, and maybe some of the things they went through when migraine wasn't as well understood as it is today. They want to make sure that we're moving forward.